Hello. Hi, everyone. I'm Rundy Murphy. Sorry. Hi, I'm Rundy Murphy. I'm epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Tuesday, January 26th. Here, just to give you a couple of brief updates about primarily focusing on COVID vaccination. I do want to address one thing that we were asked by the media today in our daily report, reporting on 32,280 COVID cases. That was an increase of 387 yesterday. And the number of people who died with COVID reported to us was added, 15 were added yesterday. So that is an unusual event. And I've mentioned before that the state is continuing to work through death certificates and comparing those deaths to our COVID lab result database to see if any of the 3,000 or 4,000 death certificates that were not coded as having been related to COVID, if they actually were related to COVID. So working through that backlog every once in a while causes a, a rather large increase in the number of deaths. So we'll take a look at that. And generally, those are just dispersed, in the previous months. And so we usually see that normalize a little bit when we produce our weekly report. So that is probably what's happened there, but I'll take a closer look and let y'all know more about that later. So, just a couple of things to talk about. So, we have a news release that went out just a little bit earlier talking about our COVID vaccine event at the cruise terminal tomorrow. So, again, this tomorrow will be our first event where we're actually giving first doses and second doses at the same event. We have been last week had been giving second doses at the health department for employees only, but for people who were vaccinated by the Mobile County Health Department and in the end of December, those of you that are due for your second dose, we're going to be offering vaccine to you tomorrow, and then we have some first dose vaccines available. So we'll be providing Moderna, the same vaccine that we've been giving, and this is only to persons who are eligible according to the ADPH plan. So healthcare workers, first responders, anyone who works in a health-related field directly with COVID-positive patients, and people 75 and over. So the second doses, and again, this is only if you are vaccinated by Mobile County. Bring your card, bring your vaccination card. You'll need to have that. That will be in the morning from 9, start in the morning and go throughout the day. And then we will invite people, first come, first serve, starting at 11. So again, the terminal will be open, sort of our normal hours, 9 to 3. We may have a few people coming in earlier than that. But first dose will only be allowed on a first come, first serve basis starting at 11. So that's at the Alabama Cruise Terminal at 201 South Water Street. Patients should enter at the main cruise terminal entrance that's on Eslava Street. But if you follow your Google map to 201 Water, you'll get there. You'll need to show identification in your car before you're allowed into the parking structure. Again, first come, first serve basis, only to those who are eligible. Some things that would make you ineligible for vaccine is if you have received another vaccine within the last 14 days, or if in the prior 90 days you have had treatment with monoclonal antibody or convalescent plasma. That would also be a reason that we'd want to defer vaccination. Also, if you are currently at home because you had a COVID diagnosis, or if you are at home monitoring because you were exposed to COVID, stay at home. You'll be turned away if you are still within your isolation and quarantine time frames. We need you to stay at home so that you're not spreading COVID at our vaccine event. And again, if you have underlying health conditions that cause you to have a little bit of concern, should I get the vaccine if I'm on a blood thinner? Should I get it if I have high blood pressure? Should I get it if I'm allergic to sulfur drugs? Talk to your healthcare provider about those things before you come. There are some contraindications for getting vaccine, the ones that I just mentioned, and then also if you have had an allergic reaction to any other vaccine or vaccine component, it doesn't mean you're ineligible to receive the vaccine. It just means that we need to watch you a little bit more closely after your dose. So again, next opportunity tomorrow, the 27th, and then after that, We have a clinic at the cruise terminal on Friday, but it is for second doses only. We expect that we will give all of our first doses tomorrow between 11 and 3. We could give away up to 800-900 first doses tomorrow. If we're able to deliver all of those tomorrow, then it will be second dose only on Friday. If that changes, we will let you know. Remember to continue calling 410-MCHD or checking our website at mchd.org for the latest and last minute information on vaccine clinics. The reason it's so last minute, we're not trying to hide anything. We're not trying to, pull wool over anyone's eyes. It's just that we have not been finding out until late on Friday afternoon whether we will get vaccine allotment for the next week. We did not receive an allotment of first dose vaccine last week. We are not going to receive an allotment of first dose vaccine this week. We won't find out until Friday late afternoon whether or not we'll receive an allotment the first week of February. Hopefully, later this week, we will be able to announce first come, first serve, among those who are eligible clinics at 4 outlying Mobile County Health Department locations. If you have been taking a look at the COVID vaccine map that shows the locations of places around the state that are that have been approved to receive vaccine or have approved vaccine, you may have noticed that we have first dose vaccine available at 4 of our outlying clinics. We're hoping to get those clinics planned for next week and announced later this week, so stay tuned for that. One thing about the map, if you have gone on the map and you see the places around Mobile that the ADPH is reporting as being a COVID vaccinator, that doesn't necessarily mean that they currently have first dose stock. It could mean that they received an allotment a couple of weeks ago and they're still on the list, or that they've been approved and they may not have even received vaccine yet. So just again, be patient until more vaccine is available. We still have woefully fewer doses of vaccine than we have people eligible to receive it. So I also wanted to give a little information about that. So ADPH released some information to say that, right now, healthcare providers, nursing home residents, law enforcement officers, firefighters, and persons over 75 make up about 700,000 people across the state. And Alabama is only receiving 50 to 60 doses of vaccine each week. They have 50 to 60,000. What did I say, 100?
50 to 60.
Okay, 50 to 60,000. Sorry. Thank you, Mark. So in total, about 500,000 doses have been delivered to Alabama, and there are over 880 providers who have signed up to distribute those doses. So if you do the math, when we get an allotment or when Alabama gets an allotment of 50 to 60,000 doses, if they sent it to everyone, providers would get 50, 60, 70, maybe 100 doses if they were lucky. So what the state is doing is trying to get into a rhythm of rolling out using some grouping that where they will not send vaccine to everybody every week, but will allot vaccine to some groups in week 1, some different groups the next week, different groups the third week, to try to get into a rhythm of getting that vaccine out. And again, right now, as of today, there has been no expansion of eligibility beyond those 1A plus situations. So keep your ear tuned. There's lots of talk about when that might happen. All right, so a couple of questions. Someone asking me about Mardi Gras best practices and asking, we know that most of the parading organizations have announced that they will not have parades this year and their balls will be postponed. There are some other things that we hear are happening. Some cities may be doing small parades, some neighborhoods. There is a lot on Facebook about Yardy Gras and the porch parades, and we hear a lot of downtown and around town bars and restaurants talking about having Mardi Gras celebrations. So again, the state health order, which was the Safer at Home order, which was was extended requires wearing facial masks if you are in an indoor public space or if you're at an outdoor gathering where 6 feet of distance cannot be maintained. That is still a requirement. So we expect that people will adhere to these requirements. At least I shouldn't say expect them to. I hope that they will. This applies to any gathering. We saw how bad COVID can get after gatherings. It is a fact that gatherings spread COVID, particularly gatherings that don't facilitate distancing and mask wearing. And that's when you're in a restaurant or bar eating or drinking. So please, please avoid crowds during the traditional Mardi Gras season to protect yourself and your family, to protect our workers, to protect our hospitals. I really would not like to see a repeat of the historic increase in COVID cases and hospitalizations and deaths following the gatherings that occurred over Christmas and New Year. We know what we need to do to stop COVID transmission. Wear a mask, distance, stay at home if you're sick, get vaccinated as soon as you can. I mentioned about the numbers, and then someone asking how many doses do I think they'll distribute on Wednesday. I think this question is about how many doses do you think Mchd will distribute at the Mobile Cruise Terminal tomorrow. I expect it'll probably be somewhere around 1,000 doses with first and second doses combined. And again, just want to thank our partners at the Mobile, Alabama Cruise Terminal, with the city, with the sheriff's office, everyone that helps us pull off these large events. We couldn't do it without you, and we appreciate your continued cooperation and collaboration. So that's all for today. We'll come back tomorrow. If we have any more details about additional COVID vaccine events sponsored by the Mobile County Health Department, we will let you know. Thanks, and talk to you tomorrow.